Must the woman deliver by an operation?
No.
No.
The answer is definitely no.
Okay, sir.
So it also depends on the location of the fibroid
Okay.
and also the size of the fibroid.
Okay.
Because fibroid can, on its own, reduce uterine contractility.
Okay.
But during labor, you need the uterus to contract after delivery.
Okay.
That can affect that and cause bleeding, postpartum bleeding. But it depends on the size of the fibroid and the location of the fibroid. People can deliver with the fibroid.
Yes.
And there won't be any problem.
Okay.
So on its own, does not.
It does not mean. So it depends on the assessment made by the
Yes,
specialist.
yeah.
Yes.
And the size and location of the fibroid.
Yes. Okay. Thank you, sir. If you have a fibroid and you deliver a baby by operation, can the fibroid be removed? Like, assume a woman has a fibroid and she now delivers by cesarean section.
Yeah.
Can we remove that fibroid during the cesarean section? Because some people would like to say, okay, let me use one stone to kill two birds and get rid of this thing.
Before now, we don't advocate that because it's a hazardous operation.
Yes.
Because a woman can bleed to death if care is not taken. But in a carefully selected patient, and when I say carefully selected, means that the doctor who want to go into such procedure must have planned, make provisions for that. For instance, now you are operating a woman and want to do a cesarean section, the lower segment, and then there's a small size fibroid along your path of incision. You remove it. But you must plan it. In other words, planning means that you must have known that you're going to encounter this and then know what to do if there are problems. So, but if you've not planned for such, we don't advise you remove fibroid during cesarean session. You deal with the cesarean session itself completely, and the woman comes back for myomectomy. It's preferably safer that way.
Yes.
But in selected patient, you can actually do it.
Okay.
But you must plan it.
Okay. Okay, sir.
It should not be an emergency procedure.
Not be an emergency
yes.
procedure.
It must be an elective procedure that is well planned.
Okay.
Yes.
That's important to note. So, sir, what makes fibroid go back after it's been removed?
Like I said, fibroid is a hormone-dependent tumor.
Yes.
And that is why we don't see it before puberty and hardly see it after menopause. It's a hormone-dependent tumor, and during that reproductive age group, that's when you have the surge of these hormones.
Yes.
And number two is that at times when we remove fibroid, some people don't take out actually time to resolve it. You have some seedlings that are there. If you don't take out time meticulously to remove all these seedlings, just give them some couple of months, they will grow. That's why if you want to do fibroid operation, we advise you work up your patient properly, localize this fibroid, and make sure that you remove, no matter how tiny they are, remove all of them. If not, after removing the big one and leave the small one, the one will come back again for myomectomy, recurrent uterine fibroid. Because those small ones you've left there will grow.
Yes.
Yes, that's what really happened.
That's why they will grow back.
They grow back.
Wow. Thank you, sir, for that explanation. So, viewers, we'll be going on a break shortly, and when we come back, we'll keep talking about uterine fibroids. Thank you.
And welcome to Clear on Health. And welcome to Clear on Health.
TSTV, connecting your world.
Welcome back to our program, Clear on Health, on African Health Television on TSTV. My name is Dr. Funmilayo Olusoji. With me in the studio is Dr. Samuel Ezekwere. We've been talking extensively about uterine fibroid. So, sir, assuming someone knows that they have uterine fibroid, has been diagnosed, because one of the problems that people have or face in Nigeria is the problem of the cost of accessing care. And then they are under NHIS. Will NHIS pay for it? Now, NHIS is National Health Insurance Scheme in Nigeria. Will they pay for that procedure?
Yeah, certainly they do.
Okay.
Yeah, but before they can pay, you must have passed through the normal protocol.
Okay.
Yes, if you've gone to your secondary or tertiary level of care where you assess your care, and then you've been diagnosed and you were booked for surgery. Before the surgery, they must have written to your HMO and they must have given their permission for it to be done. But they do.
Okay.
They sponsor it if they are aware.
Yeah. If they are
If the proper
aware.
procedure is followed.
Okay.
If you do the proper thing, they will
They
sponsor
will
it.
sponsor it.
I'm also aware that a certain percentage can be paid by the patient. Yeah, and some of these things they will ask you to pay some 10% or something, or they're going to the actual cost, the total cost, but they sponsor it.
Okay.
They do.
Thank you, sir, for that, explanation. So, sir, what are your final? We've been talking about uterine fibroids. You've shared a lot, from the causes, risk factors, treatment, diagnosis. What are your final words about uterine fibroids to women at home? That they can talk to their daughters about, their sisters, their aunties, about, what they've learned so far from you.
Okay, I want to say that uterine fibroid is a benign tumor.
Yes.
In other words, it's not a malignant. We don't talk about malignancy, we talk about cancer. So it's usually non-cancerous in most cases. And it's not a death sentence. And that is why if somebody is presenting with symptoms, the best thing to do is to go to your health care provider and discuss. If these things are properly discussed, that's why if it's properly discussed and attended early enough, it's not a big problem. But we have noticed that some women, out of fear of the surgery, will leave the fibroid until it becomes like 38-week size. Pregnant size. Becomes so massive that even to operate becomes a problem. They were told about this fibroid maybe from 3-5 years ago. They refused to go for treatment and they left it. It now become, because if you leave the fibroid, it keep on growing. It doesn't stop until you get to menopause. That's when your estrogen value will go down. That's when the fibroid can stop growing, but it's there. And so if you have identified this and go for early treatment, I don't think it's a problem. Can be removed, you go about your normal life. And thank God surgical skills has improved tremendously.
Yeah.
Nowadays, that these things are no longer a problem. You can do these surgeries and go back to your normal life within a few days. And now, even if you don't want open surgery, there are some things that can also do what we call minimal access surgery. If you have, your fear is cosmetics. You don't want to tamper with your normal anatomy.